Hey guys, welcome back to Medicine Deconstructed. I'm your host, Dr. J. Rutland. I appreciate you guys being here. Today, you'll notice that I'm wearing pink. The reason that I'm wearing pink is I thought I'd spend today discussing a topic that is near and dear to my heart, as I have had multiple relatives affected by cancer, breast cancer specifically, hence the pink. It's a very difficult topic to address, but I think it's one that needs to be addressed. Being an ICU physician, I see patients at the end of their life, and some of these patients have cancer that is rampant throughout their entire body. And it's my duty, and it's my job, and it's my pleasure to explain to their relatives and to their loved ones about cancer and what's going on in their body. Whenever you think about cancer, everybody gets really, really worried. They're scared because usually cancer carries this sentence where they think somebody is gonna die. And that might be the case. It can happen. But I think we have to have an understanding of cancer and what it is. Cancer is abnormal growth of cells from a particular organ that can spread to other organs. What I mean by that is, once those cells become abnormal and they start dividing and growing, they start to obtain certain characteristics, and they're able to get within the bloodstream, and they take advantage of the bloodstream, and they spread to other organs and set up shop. When that cancer grows in other organs, the cells of that one organ in which the cancer cells are now present, they start to break down. They start to not work because of the presence of these abnormal cells. Other organs begin to shut down, and just like we've spoken about before when we're talking about organ failure, the organs fail. And that can lead ultimately to a patient's death. But there are treatments and there are regimens, and some of those treatments we define as chemotherapy. Chemotherapy is a regimen that helps to stop cells from dividing. Every cell in the body undergoes a process that we call mitosis. That's basically just reproduction of its own self. The cell makes itself again, it divides and splits into two. From two, it'll split into four, so on and so forth. Cancer is an abnormality of that division. To undergo that division and to divide and reproduce, you have to reproduce DNA. DNA is what resides within the cell and tells the cell to produce certain proteins. What chemotherapy is it's actually the inhibition of the production of DNA. So when you're doing that, you're not exactly targeting the cancer cells, you're targeting all the cells that grow fast. The cells that grow fast include your immune cells or your white blood cells that fight infection. Those cells live on average for about 5.5 days, but they only spend about 8 hours within your circulation. So when you're undergoing chemotherapy, you're gonna develop what's called neutropenia, which is a low white blood cell count, which makes you more accessible to infections. You can get an infection, and an infection can cause a lot of inflammation in your body and can ultimately lead to you becoming really sick and seeing me in the intensive care unit for critical care regimens. But I think we have to understand that cancer is an abnormal cellular growth. That growth spreads to other organs. Those other organs can shut down because of the presence of those abnormal cells. And chemotherapy is built to combat that, to inhibit the DNA. But in the process of inhibiting that DNA, it also inhibits DNA of your own cells, leading to things like neutropenia, where your white blood cell count is low and you're more susceptible to infection. It can lead to nausea, vomiting, and loose stool, because the cells within your GI tract only live for about 24 hours or so. And those are the side effects of chemotherapy. And those are just some of the side effects of chemotherapy. There are many others depending on the regimen. But that's why cancer can be so devastating. But there is a light at the end of the tunnel. And that tunnel is chemotherapy. And now with chemotherapy advancing into different kinds of molecules, there is hope. And we're gonna continue to have that hope, and one day there will be a cure for cancer. I hope that I've answered any questions about cancer and chemotherapy. If you have any questions about cancer or chemotherapy, please leave in the comment section below. I'd be happy to address them in the future. And again, thanks for watching Medicine Deconstructed.